Hello, everybody, and welcome. I am Gabby Panetta, and today I have the pleasure of interviewing someone that I'm a big fan of, Rabia Mirza, who is a pelvic physiotherapy in Mississauga at Mississauga Pelvic Health. Welcome, Rabia. It's such a pleasure having you. Thank you so much for joining me today.
Thank you so much, Gabby. It's a pleasure to be here. Thank you for having me.
Oh my goodness. I want to know, so pelvic physio, you're a physiotherapist first, and then you specialized in pelvic physiotherapy.
Yes, yeah, that's correct.
Okay.
Yeah.
Okay. It's a fairly new yet fastly advancing field in physiotherapy, and I'm so glad that I came across you. And I was fascinating because, and I think I told you this before, I believe that you are one of, and I don't say that because I'm biased, but you are one of the best physiotherapists because you really educate the client. You're super patient. You don't, talk like the big talk, and you put it into the simplest terminology ever. And your understanding, your knowledge is beyond what I've seen with any other practitioner, not just physiotherapists, but chiros. I was really pleasantly surprised, actually shocked. But when the opportunity came for me to start these podcasts again, I knew I had to have you because I am a huge promoter now, ever since meeting you, of educating clients as well and letting them know that there are other answers, natural treatments for what they may be going through that they don't even know. So,
Yeah, you are so kind. Thank you so much. Those are such, that warms my heart because I really do think as practitioners working with people, it's
mhm,
not just enough that we're good practitioners. It's about knowledge translation and feeling like our patients they're understanding what's going on with their bodies.
absolutely. And you're the one person that I can say you're the best at doing that. So thank you for that.
Thank you so much.
And I'm just going to go straight into the questions now. So tell us, what is pelvic physiotherapy and how did it come about?
Yeah, absolutely. So, in pelvic floor physiotherapy, we assess and treat everything related to the pelvic floor. So,
Mhm.
these are conditions related to bladder, bowel, sexual functioning, and also any pain related to anything to the pelvic floor, our hips, our low back, into the abdomen. It's all kind of related.
Yeah.
In terms of how it came about, I'm so glad you asked me because I also had to do a little bit of a deep dive in like where did this start out and how things have progressed, right?
Yeah.
We just
Yeah.
kind of get into it, but like the history of it is kind of interesting. Truly, honestly, when I was doing my research into that, it was in the 40s where it's a gynecologist and his name was Arnold Kegel, who kind of
Interesting.
right? Yeah, yeah. Because I didn't even know where this idea of Kegel came from, but
Yeah.
gynecologist in the 40s who
Mhm.
found that doing these contractions of the pelvic floor, a Kegel exercise, is
Mhm.
what helped in preventing urinary incontinence in women and in men.
Mhm.
And since then, I think in the 60s and 70s, it's really grown to include, at that point, it was gynecologists, physiotherapists were really starting to pick this up because
Mhm.
we do work on conditions related to muscles, really. And
Mhm.
then since then, and I would really say in the last 20 years is when things have really picked up, where there's, a bigger appreciation for what these muscles do and how much of a role they play for these really important functions related to bladder, bowel, and sexual functioning.
Absolutely. And so, what made you particularly choose this field of specialization in physio?
Yeah, absolutely. So this was definitely not the plan going into physiotherapy.
Mhm.
My specialty was really focused on sports physiotherapy to start off with, but I always felt like something was just missing when I was in the sports physio realm. Um, there was you make an impact in people's lives, but I had taken the first level of pelvic floor physiotherapy because there are different levels of it.
Mhm. Mhm.
And it just kind of happened by chance. And I figured, hey, might as well just get a certification. Who knows if I'll continue with it?
Mm.
So when I started kind of getting away from the sports physiotherapy and I'm like, let's give pelvic floor physio a try. The more that I work with, and I particularly just work with women for pelvic floor physio,
Hmm.
I saw that it was just it went beyond just helping them, muscles getting stronger. I felt like I was really making an impact in their lives and their day-to-day functioning.
Yeah.
So it's like just that factor of like, wow, this is so rewarding. Someone's like, you've made a difference in my day-to-day life. I feel like I have my life back. I don't have to think about going to the bathroom, pain with intercourse in my day-to-day life.
Yeah.
And then from there, I just kind of took off and I specialized in it exclusively.
Yeah. And you're phenomenal.
Thank you. Thank you so
um,
much.
So, are there different approaches to pelvic physio? Because before meeting you, I had come across other individuals who said they were pelvic floor specialists, but they only worked on the outside of the body with exercises, etc. But then I met you, and you do both. So, how do they differ?
Yeah. So Um, in terms of, I'm a little biased because truly and honestly, I think when working with the pelvic floor, going internal and
Mhm.
for women that will look like going internal vaginally, and rectally if needed, and for
Mhm.
men that looks like going internal rectally. Just in my opinion, I find that if we're not doing the internal part of it, we're missing a massive piece of the puzzle.
Right.
Because a lot of the times that coordination of learning what's going on in the inside, learning how to feel for a relaxation, learning how to feel for an engagement, a contraction into there,
Yeah.
it's very hard to do if we're not internal and we're giving you that proprioceptive feedback.
Right.
There are some, conditions in which maybe that's not necessarily needed for pelvic floor physiotherapy and you
Mhm.
can do a lot of the work on like the external pelvic floor muscles because we do have muscles that are on the outside and
Mhm.
then we have the muscles that are on the inside too. There's just kind of layers into it.
Right.
So in my opinion, I really do think that it's so important to get internal and get that connection into the body,
Yeah.
but there are some therapists who do work just the external. I find that if the external is working for you and it's making a difference, great. But if you're
Mhm.
finding that you're still not really getting the results that you want in your treatment, then find someone who can do the internal examination. It makes a big difference in even just your own proprioception and having that mind muscle connection.
Right. And then how do imbalances in the pelvic floor affect your health, other areas of the body? Because I was shocked to find that so many things could be treated with pelvic floor. Not just because most people assume that it's for pregnant women or women who've given birth and have issues with incontinence, but that is not the case at all.
Yeah, absolutely. Thank you for bringing up that point because although, we do, I don't want to say primarily, but that is a big part of what we do is treating those muscles. These
Mhm.
muscles have such an important impact on different areas of the body. We really go in with the thinking when treating the body that, things don't work in isolation.
Right.
One part of the body is related to another part. And when things may not be working as well in one area, other things kind of compensate. So when we're working into the pelvic floor, what we really see is that these muscles, because they kind of line the bottom of the pelvis, I should have brought my model, it would have made more
That's
sense.
okay.
They line the bottom of our pelvis. This has implications into our low back. This has implications into our hip, because even some of the muscles that are into our deeper hip, those deeper hip rotator muscles, they do cross into the pelvic floor as well. So it has all these connections into our hip, into our low back. And this in turn, if you might be someone who's been dealing with this chronic deep hip pain. You've done all the work on the outside, you've gotten the massage, the exercises, but
Yeah.
something is just not working. We do see a lot of that in clinic of, okay, let's go internal, let's see what those muscles are doing. And it might be that these deeper hip rotator muscles that we just can't get to on the outside are the
Hmm.
culprit. And we're able to really target them in pelvic floor physiotherapy. So that and just, yeah, the back. Think of the back. We have, majority of people have a lot of low back pain. The low
Hmm.
back and the pelvic floor muscles are so intimately related. If one area is holding with lots of tension, or let's say an area is holding weak,
Hmm.
immediately because they're so intertwined with each other, the other area will kind of pick up that compensation and hold a certain way as well. So
Yeah, yeah. And that brings me to which factors affect the imbalances in the pelvic floor? So you mentioned, the hips, so that's the bone, and then there's the muscles, and then I'm huge on connective tissue.
yes.
And then there's trauma on top of that. So let's talk about first connective tissue and then how trauma, whether we had a fall or whether there was abuse of some sort, how that could potentially affect the pelvic floor.
Absolutely. So connective tissue is so important when dealing with a lot of pelvic floor conditions. And when
Mm-hmm.
we talk connective tissue, to try to explain it, is we have connective tissue, which is fascia that runs across all areas of our body.
Mm-hmm.
When we're looking at the pelvic floor, especially, we look at a lot of that connective tissue into that lower abdominal region, and then also just into the pelvic floor itself.
Mm-hmm.
With this fascia that's lining all these organs, we want to make sure that this connective tissue is not holding with tension. When it's holding with tension, it starts to restrict our ability to even take a deeper belly diaphragmatic breath. If we think of that connective tissue around our lower abdomen, it's crossing all of these organs as well. And all of our organs, they have their level of, they've got to expand and they also have to contract. Think of even just the bladder itself.
Yeah,
Our bladder is something that needs to have the ability to expand.
yeah.
If connective tissue is holding really tight around those areas, it doesn't
Mm-hmm.
really allow it to have its movements that it should have. And that in turn can cause, things like overactive bladder, some leakage. And the interesting thing with connective tissue is that it's not just like, an injury can cause things to tighten up, where our body's in this protective mode, and
Mm-hmm.
things are not quite moving. And over time, we see that result where organs become constricted. But there's a huge connection into even just psychosocial factors as well. If you're someone who is always in that heightened nervous system response,
Yeah,
you're stressed all day long, you feel it in your body, you can feel it in your neck, your jaw, all of
yeah.
these areas. Think of that nervous system will also start to affect how we hold tissues in that core area into our pelvic floor. So things end up holding tight, and you don't even realize that this is your pattern all day long until we start to touch that connective tissue and start to get things moving. And a lot of my patients who have that pattern into there,
Mm-hmm.
um, they almost find it like weird to even take a deeper breath and even getting connective tissue moving. They're like, this is such an odd sensation for me. And it's not anything deep. We're not trying to rip through muscles.
Mm-hmm.
It's just this overall ability of your body to relax and open up as well.
Yeah, like um, for me personally, breathing into my pelvic floor, I never thought that was a thing. But when you
Yeah.
feel it and you experience it, it's really mind-boggling how we can relax that girdle in the body
Yep.
through just breath work. But
Yep.
you need someone to guide you through it if you're not aware that this is possible. So
Yep.
that was huge for me.
Yeah, and it
Uh,
almost becomes like a new way of just kind of holding your body day to day. I have so
yeah,
many patients who come back and they're like, "Oh my gosh, I didn't realize that I hold like this, like my glutes, my belly all day long. I had no idea until
yeah,
I started to do this breath work." And I'm like, "Wow, like think of all the tension I've been holding into there."
absolutely. And I think that the misconception or misteachings, I guess, regarding Kegels, that women have always been told to do Kegels because, God forbid you have weak um, vaginal muscles, and it's actually counterproductive in the long run for many women. So Kegels are useful in certain situations, but not all the time, and not everyone should be doing Kegels.
Yes.
So that was huge learning as well.
Yeah, absolutely. I'm so glad that you said that because we always tell anyone, any presentation that we're doing, it's not all about Kegels. They're important, just like any other muscle in the body. I think of my biceps. I want to be able to engage this,
Yeah.
but I don't want this to be sitting here all day long. I also want this to be completely
Right.
straight in that resting position at rest, but then
Yeah.
strong when it needs to be strong.
Exactly. So strength with flexibility, that's the key to everything in the human body. Um,
Exactly. Yeah.
okay, so how we talked a little bit about the fascia and how damage or restrictions can affect that connective tissue. And for those of us, for those out there who don't know what connective tissue is, it's really like a web throughout the body. It's in between all the fibers of every muscle. It holds all the muscles in place. It holds all the organs in place, our veins, our nervous system, everything sort of, and it's the metaphor, well, it's not even a metaphor, it's actually fascia in steak or chicken cutlets. When you go to prepare them, you see this little thin sheath that's on top and you have to kind of take it off. um, that is fascia, that is a connective tissue, and we have that in our body as well. So when we talk about that, this is what it is, people.
Yeah.
um, so does pelvic physio look at only the pelvic floor? And the reason I ask is because, again, diaphragmatic breathing works with the diaphragm girdle. And that's where most people learn, okay, deep, deep diaphragmatic breathing. But then you learn to breathe into the pelvic floor. So are you strictly restricted to the pelvic diaphragm, or do you also work with the diaphragm above that, which is just under the ribs?
Yeah, absolutely. So with this, it would depend on the pelvic floor physio's training as well,
Ah,
because
okay.
working through fascia, it's actually additional training that you do outside. Well, I mean, I shouldn't say outside. It is a part of the pelvic floor physio world, but
Mm-hmm.
you do need the extra training in order to work around the fascia as well. So that's one thing I
Yeah.
always like to say. Depending on the physio and how much of those continuing education courses they've taken,
Mm-hmm.
they might be doing a lot of fascial work, as I do in my practice.
Yeah,
I
you do.
work through that diaphragm. We find restrictions. We're working through the fascia all and through that abdominal region.
Mm-hmm.
We work a lot with people who suffer from constipation and even just working in through the large intestine system as well, working through the fascia into there.
Yeah.
That is all a part of what we do. And then, of course, depending on what courses that you've taken as well.
That's good to know because when I refer, I don't necessarily know that I didn't know this before. So this is good to know.
Yeah, yeah,
Awesome.
yeah.
Okay. So my next question is how does or what conditions can be improved in women specifically with pelvic physio?
Yeah, absolutely. So there's a plethora of things. I'm going to name some things off just so it can kind of correlate with some people if they're experiencing. So
Mm-hmm.
anything related to the bladder. So probably the biggest thing that we're seeing coming into the clinic is incontinence, and
Mm-hmm.
that could be related to sneezing, coughing, exercise. It could be related more to urgent episodes where you're running to the bathroom and there's a little bit of a leak.
Mm-hmm.
Anything to do with the system might just be off as well, where you're getting a strong urge to go, you sit on the toilet, and then you just can't go anymore. It's just not
Ah,
coming out. So that bladder system, there's quite a bit of coordination that needs to happen as well. Things need to learn how to relax when they need to. They need to know when to tighten and engage as well. So
okay.
outside of even just leakage, we are kind of like teaching that whole urinary system how to behave well, and just bladder training overall of getting rid of just in case pees, all of that things that could
Mm-hmm.
over time lead to some issues in the future.
Okay.
In terms of bowel health, we do treat a lot of bowel conditions. Constipation is one of the biggest things that we see in pelvic floor
Interesting.
physio.
Yeah.
And a lot of that is us working through evacuation difficulties. That is an actual manual thing that we go in rectally and start working on the muscle so they know how to relax and release.
Interesting.
Hemorrhoids, anal fissures. That is a huge part of what we treat, and we've been so happy to see more referrals for that versus, getting a surgery that may take a long time to heal. When in actuality, there's a lot that you can do to manage it from just a conservative approach.
Right.
Sexual health conditions, we see a lot of that in practice,
Mhm.
whether this is pain with intercourse, different types of pain with intercourse as well,
Mhm.
and different reasons for that pain with intercourse, whether that's related to the muscles, whether that's related to a history of trauma, and that's why, intercourse becomes a little impossible to go through. We do see that, and I always like to normalize it because that is a huge part of what we're seeing in clinic, and definitely something that to be worked on. It's not enough to just be like, oh, it'll get better with time or drink some wine, you'll be okay. It is a pelvic floor condition that can be treated. And
Yeah.
those are like the ones that we typically see that we think of, but we also deal with a lot of pain conditions as well. Whether this is chronic pain, like diseases like endometriosis, adenomyosis, and then also just, your chronic pain that you don't really have an answer for. You know that something's going on into that lower abdomen, maybe into the hips, into the low back, and there doesn't seem to be quite an answer for what's going on as well. That's when we get the referrals into pelvic floor physio. I don't know what's going on. Look at my patient. Maybe it's pelvic floor related. And typically we do find that that's a big part of what's going on as well.
Yeah. And going back to painful sex, the or painful intercourse, I think a lot of people also have the misconception that intercourse can be painful for menopausal women. So estrogen levels go down, the muscles in the entire body no longer have the flexibility that they used to have, and the tensile flexibility. Um, but there's young women that also experience this. It's not just women in menopausal times. So, and would that be more to do with either holding tension or more trauma related, or both, or it can be just about everything?
A little bit of both, actually. We do find that we'll have some women in and they're like, I don't have a history of trauma. Like, I feel like I'm relaxed. I just don't know what's going on. And
Mm-hmm.
in those cases, it's almost like a little bit of a genetic factor of their muscles are just tight. They're just tight at rest.
Yeah.
Maybe vaginal canal might be a little bit smaller than
Mm-hmm.
what we would typically see on average as well. And
Yeah.
even with that, we're able to work through. And then, yes, on the other side of it, we do see the trauma related, unfortunately, situations with the pain with intercourse. And
Mm-hmm.
we do kind of treat them a little differently. And that's important to note too, that with pain with intercourse, you might be having pain, but depending on why you're having the pain, we might be treating differently.
Mm-hmm.
With someone who might just have that genetic factor, there's not really the social part of it, there's not the psychological part of it. We're really just working through getting those tissues to open up, a lot of stretching, a lot of dilating.
Yeah.
But with someone who has that more complex trauma that's playing into this, it's really important for us to address the nervous system as well, and
Mm-hmm.
wanting that nervous system to know that this is safe. I can relax. I'm not going into a protective response. It's not
Right.
enough to just go in and stretch muscles. It's also kind of teaching the body that I can release and let go, and I'm okay with doing that without getting into that trauma or pain response and tightening up.
Right. And that's specifically to, let's say, abuse type of trauma, but there is physical trauma too. So, for example, if somebody has a fall and they fracture their coccyx, the coccyx then, instead of being kind of curved like so, um, it can do this, or it maybe can be twisted a little bit. And that will affect the way that the muscles and the tendons that attach to that bone behave within the pelvic floor and cause restrictions and a lot of pain and a lot of difficulty with evacuation as well. So,
Absolutely. Yeah, yeah, absolutely. That's a big one into the tailbone and the falls that we see into there. And you've
yeah,
explained it so well. Like that's exactly what it is. It will change position, and our rectal system into there, especially at the end of the rectum, it needs this nice pathway in order for the stool to pass. So if that tailbone is holding, crooked in some sort of way, that's going to affect the muscles and it's going to affect the pathway of evacuation.
yeah. And some people don't realize, like when we're young, we just kind of walk everything off, and we've always been told, like, if you fall and you break your tailbone, there's nothing that can be done, so don't even bother, right? It'll take
Yep.
6 months to heal and move on, but
Yep.
that will catch up.
Yes. Yep. Yep. Absolutely. Absolutely. Yep.
Yeah.
Yep.
Okay. So, um, what conditions can be improved with men with pelvic physio? And I know that's not your
Yeah.
focus and the scope that you work within, but I know that men, for many, many men, there's so many conditions that can be helped and improved upon with pelvic physio without the need for, pills, blue
Yeah.
pills.
Yeah, yeah, absolutely. So with men, it's similar to women in the fact that we're also looking at bladder conditions. So with the bladder conditions, mostly what we see in clinic is just issues with the prostate can really affect urinary urgency and leakage as well.
Yeah.
So we do treat a lot of men who have prostate condition and prostate issues as well, affecting the bladder.
Mm-hmm.
Bowel health, the same thing, constipation. Pain with intercourse, and for men what we're seeing is it's more of a pain with ejaculation more than intercourse in itself. And then
Okay.
we do like to say that erectile dysfunction, it is related to the pelvic floor because it is a flow of blood flow into that muscle, and if tissue is restricted in some sort of way, that's going to prevent an erection from occurring. So our physios work through a lot of the connective tissue, a lot of the muscles with men in order to achieve an erection. And then also dealing with the pain as well. Typically, it is related to very tight tissues that just can't let go.
Wow. Yeah, and then it's, for people, sexual health is very, when it's not working well, it's very demoralizing. It causes depression. It causes, the fear of rejection. There's so many factors involved that can be easily solved with pelvic physiotherapy. So if you're out there and you are having any of these issues, please see your nearest pelvic physiotherapist. And that brings me to another question that I was going to ask ahead, but we might as well just ask it now. Are you able to do online pelvic physiotherapy consultations?
Yeah, so this one, this will just be my opinion, just with
Mm-hmm.
what I've worked with. We absolutely can do virtual consultations, and I know a lot of pelvic floor physios, just to make it more accessible throughout people everywhere, they are doing more of those consultations.
Mm-hmm.
I don't like doing those consultations. I'll be completely honest.
Yeah.
I think even if you're able to get in one time, even if it is a little bit further away, but you're able
Yeah.
to have that internal session. From there, we
Mm-hmm.
can have more of the virtual consults because you have that understanding and awareness of what I may be explaining.
Right.
I find that during COVID, when I was doing a lot of just the virtual,
Mm-hmm.
I don't think I was seeing the results that I was when those patients were then able to come in and we were able to really go through everything in person, having that that proprioception, that body awareness that we were able to teach when we were coming in.
Right.
I know a lot of physios will disagree, but really do think like we're taught with our hands, and the manual work is so important to us to help our patients figure out what's going on. So
Yeah.
we offer it to have it there, but
Mm-hmm.
if you can come in even for a session, it will be so beneficial for treatment.
Yeah, and I compare it to, the people that do the external work only to the ones that do both, and I always recommend the ones that do both. And
Yeah,
so I couldn't agree any more than you, like,
yeah,
because I, what you do, I think is phenomenal, and I think that everyone at least once in their life should get an assessment done, because we think we're okay until, it's like anyone that goes for a massage, it doesn't hurt until they get touched, and it's like, oh, I didn't realize that was hurting so much. Yeah.
yeah,
Because we
absolutely.
don't realize how much stress we hold in our body
Yep.
until we get assessed.
Yeah, absolutely. And just even the connection, we don't ever really think about what our system's doing to help us pee, to help us stop ourselves from leaking.
Right.
And just being able to have some active control into those areas and
Yeah.
knowing that, oh yeah, I know when I'm holding tight and I can let it go, or I know how to engage these muscles when I need to.
Yeah.
That ability is so important because once you have it, you can take it forward in life in so many different scenarios.
Yeah. Yeah. Um, and so what activities or well, let's go into yeah, let's talk about the activities. What activities can help our pelvic floor and which ones should we stay away from?
Yeah, so activities that help, I always actually started off with relaxation. I know again, people think Kegel, but I really
Mhm.
do think with in order to have a strong Kegel that's preventing us from those leaks or whatever it may
Mhm.
be in terms of that, we still need to learn how to relax everything and have everything in a resting position first. So the typical exercises that we are giving initially as we start off is a lot of diaphragmatic breathing, being able to take a breath into that the deepest breath that you can into that lower abdomen below your belly button, and
Mhm.
even feeling that release even into the pelvic floor region. And some cues that we give for that is always it's like you've been holding in your gas in all day long and then you're finally letting that release and feeling those muscles really melt.
Yeah.
So we really started off with that. And then we really like yoga poses as well because we find just getting
Mhm.
into different yoga positions, your cat and cow, your child's pose, and the way that your pelvis moves and stretches, internally, there's a release that's happening into the pelvic floor. You just don't even necessarily feel it. So
Nice.
being able to do some of the yoga positions really helps. And then outside of that, if we're seeing that there's a big loss of strength, there's leakage that's going on, that's when we start to add in the Kegel as well. But we always
Mhm.
kind of started off with having that body awareness of learning how to relax before we learn how to engage.
Right. And then how many sessions can a client expect to start seeing results? And I know that every client is different. There's clients that do their homework afterwards and the ones that don't, and you can tell.
Yeah, we can tell. Yeah.
Yeah, don't try to cheat because they'll know. So, how does it have to do with how complicated things are? What affects results?
Yeah, so again, of course, like you said, it all kind of depends on what we're seeing.
Mhm.
Typically, to truly see changes in the muscle and results in terms of that, we're seeing 6 to 8 weeks is what we're really thinking of, or
Okay.
I should even say 6 to 8 sessions is really what we're looking at.
Yeah.
These sessions aren't necessarily weekly. The way that I do it is maybe starting off with, I'll see you weekly for about 3, 4 sessions so
Mhm.
that we're really working on the manual therapy at that time, depending on what you're coming in with, especially if there's been a history of pain,
Mhm.
or if we need to do a lot of proprioception work of kind of teaching muscles how to engage.
Yeah.
Once you're starting to get the hang of it, that's when we start to space things out a little bit because I really want to make sure with my patients that it's never just a reliance on us. It is really like a team thing. So once you have it, I'm giving you more exercises. We start to space it out because I want to see if these results are actually sticking for a longer period of time as well.
Yes. Yeah.
With more of the complicated cases, we probably are seeing them more times than that 6 to 8 sessions.
Mhm.
But it does get to the point where it's a little bit more maintenance, where, things are going well, but we're still checking in every 3 weeks, every month's time, just
Yeah.
to make sure that if things are tightening up or you're finding that symptoms may be coming up again for some reason, we're kind of catching that before it becomes like a flare up or whatever it may be. So I'm thinking of like patients with endometriosis and like more of those chronic pain conditions.
Yeah.
It is kind of like we're touching up every now and then and catching up. But initially it is that seeing more of them early on and then spacing things out later on.
Okay. Awesome. And walk me through a typical assessment. What can I expect during the assessment and a session, and what kind of homework would I have to do?
Yeah, absolutely. So we always, at our clinic, we start off with sending a pelvic health intake form in your email because
Mhm.
it is lengthy. There's a lot of things to talk about. And although you may be coming in with just, like 1 or 2 symptoms, we do want to see how everything is kind of holding together, how things are interacting with each other. So you fill this out before you come to the clinic. When you get into the clinic, we go into a pretty lengthy subjective assessment where we're talking about these different things. So I want to know about what brings you in, your symptoms, the pattern of these symptoms, when things have started, how things have progressed, what makes it better, what makes it worse. Then we'll always talk about bladder health, bowel health, sexual functioning. We want to know about any surgeries. Surgeries play such a big role into our connective tissue.
Yes,
If
they
you've
do.
had a lot of abdominal surgeries and they may be laparoscopic, there's always some scar tissue, and scar tissue will start to restrict that fascia, and over time, it can lead to some issues. So, post surgery, you might have been okay. You weren't really realizing that you're having this, but
Hmm.
over time you're realizing like I'm having a pain and nothing's really being explained. Those abdominal surgeries really do play an impact into that. So we're talking about that. Any childbirth in pelvic floor physio, we do call childbirth like trauma into the pelvic floor because it's so many changes that are going on with
Yeah.
pregnancy, with labor and delivery, with C-sections as well. So
Hmm.
getting that full understanding. And it's really important for us. We always try to talk about stress and sleep in your day-to-day life. It's so important that you go through to a practitioner that's not just looking at what you're coming in with, but really seeing the bigger picture of what's going on too. What does your work look like? How is that nervous system on a day-to-day basis? Because that will affect what you're feeling and then even just treatment moving forward as well.
Yeah.
So that's a big chunk of what we do. I would say almost half of that assessment is just that subjective history.
Yeah.
Sorry, Gabby, I cut you off. You were about to
No,
say
no, no,
something.
no. I was cutting you off. But it came to mind that, people who maybe drive for a living, who drive, 12, sometimes 24-hour shifts, or
Mhm.
people who travel long distances on a day to day, they're going to have pelvic floor issues most likely because there's very little circulation going on in the pelvic floor. There's
Yes,
no movement, or people who have sedentary jobs where they're not getting up and they're doing 16-hour days, and then they wonder why things aren't working down there because
absolutely.
there's literally no circulation, no movement. For the body to be healthy, there has to be movement, and that movement helps the circulation process. And when you're sitting for extended periods of time, it's a recipe for disaster.
Yeah, and you said like the key word into there too is circulation. We're not getting blood flow into a certain area. If we're not getting blood flow, you're not really getting the oxygen into that area. So
Mhm.
over time, things will tighten. We're not getting blood flow. We're not getting oxygen. Muscles are sitting maybe in a tightened position, and over time, that does wreak havoc into there. So that's a big part of it as well as circulation and movement.
Yeah.
And then going back to the assessment, once we have that subjective history and a good understanding of what's going on, we start
Mhm.
with the objective assessment. That's when things initially start to look like what typical physiotherapy looks like. I want to see your low back range of motion. Can you touch your toes? Can we kind of move side to side with things without things feeling restricted?
Mhm.
We might even take a look at the hips and how they're rotating as well. And
Mhm.
then we really like to take a look at your breathing. That is like key in what we're assessing is the
Mhm.
breath. What do your ribs look like? Are they kind of flared out because we don't know how to take the belly breath? We have hands onto that abdominal region, and I'm working through those tissues, seeing if anything feels really restricted, if you're having pain in any sort of way as I'm doing that.
Mhm.
And then we go into the pelvic floor, and that's starting off externally because there are those muscles that are holding on the outside.
Mhm.
And then if you're feeling comfortable, we go internal and we're seeing just how the hammock is holding. And that hammock, it should have strength. We
Mhm.
want it to have strength, but we don't want things to be holding on too tight as well, because that also will start to impact what's going on into there.
Yeah.
And then after that, we come up with a little bit of a treatment plan depending on what we're finding. So that will always be a combination of doing some manual treatment on
Mhm.
my end, so
Mhm.
muscle releasing, teaching muscles how to engage as well, and then also the exercise component, and sometimes behavioral components too of okay, you go to the bathroom every single time you leave the house if you don't need to go. Let's start to bring that down and change some of those habits as well.
Ah, interesting. That's very important.
Yeah,
Awesome. Well, Rabia, thank you so much. I know we could go on for hours talking about the topic,
I know.
but if somebody wanted to book at least a consultation with you, if they're too far online, what's your website information? How can they contact you?
Yeah, absolutely. So I own Mississauga Pelvic Health, me and my business partner. And you can find us online. We are on Instagram at Saga Pelvic Health. We have our website, mississaugapelvichealth.com. And when you're on the website, it's great. You can give us a call. You can book in a free 15-minute phone consult if you're not quite sure if pelvic floor physio is right for you.
Okay.
Those would be the ways to contact us. And if you're outside of the Mississauga region,
Mhm.
Pelvic Health Solutions is a website that has a list of so many different pelvic floor physio clinics around the GTA.
Amazing.
So
Oh,
it's
that's
like,
wonderful.
yeah, absolutely. Like, definitely check that out if you're not in the Mississauga region. But outside of that, we would love to see you.
Okay, wonderful. Thank you so much, Rabia. I know that this was not an easy thing to coordinate because life happens, and but I'm so glad that we finally made it happen. I'm so appreciative of your time and your knowledge and your expertise, and I look forward to speaking soon, okay?
Thank you so much, Gabby.
Thank
Appreciate it. Thank you
you.
for having me.
Oh my goodness, it's such a pleasure.